The medications that people have to take for atrial fibrillation, to me, fall into two broad categories. So you'll have people who need to take medication to control the rate of their atrial fibrillation, and those are generally people who their heart's going fast and they're symptomatic of their fast heart rate. And those people generally will have to take a medicine to slow their heart rate down and control it. But not everybody will need that. There'll be quite a proportion of people who've got atrial fibrillation who maybe didn't even know they had it to start with, and their heart rate is nice and slow, and they can exercise and do all the activities that they need to be able to do during the day with no impact on them whatsoever. So they don't need to be on a medicine to slow their heart rate down. So not everybody needs that. The other category is to prevent the problems of atrial fibrillation, and the most important one is having a stroke. So because people are more likely to develop a clot as a result of atrial fibrillation, so if the atria in the heart are beating irregularly, then the blood doesn't flow through that area as smoothly as it should, and if blood sits in any one space for long enough, it might form a clot. People who've got atrial fibrillation are more likely to develop a clot inside their heart. It might be tiny. It goes through the heart, and the first place it hits is the brain. And if that clot lodges in an artery in the brain, then people will have a stroke. What we do to try and prevent that from happening is we figure out what the risk of that happening might be, and for people who are at high risk of that happening, we encourage them to think about whether they would like to go on a medication to thin their blood or prevent that clot from forming in the first place. And that's called anticoagulants. And the most famous one that's been around for the longest is warfarin, and most people know about warfarin, but there are other options. So there's some newer agents that have come out that really do the same thing. So that's your two broad groups. You've got the people who need the medication to slow the heart rate and make them feel better about the irregular heart rhythm, and you've got the other group of medications to prevent the complications happening of AF.